so good to see all of you. Hey, Cheryl, good to see you. Hi, happy Tuesday already. Hey, Amy, good to see you. Hi, everybody. Hey, Jake, good to see you. I love when everybody puts in the chat where they're from because not everybody goes to the same meetings. And so if you want to put in the chat where you are located, it's always so fun to see where everybody is at. It's kind of cold here. I don't know what's going on, but Boise still has not had any snow. And I know other parts of the country are freezing and snowy, but for some reason we are just dry and cold. So we are in winter time, but it's so good to see all of you. Hey, Cheryl from Portland, good to see you. I'm always so excited. Yay for Portland. And Jake's in New York City. Hello, Jake. Good to see you. Marla's in New Mexico. I bet it's kind of cold there too, huh? Yes. And Kathy from Maine. Hello, Maine. Good to see you, Kathy. And let's see, Jennifer from New Jersey. You got our snow. Okay. So good to see all of you. I just want to welcome you. I am so excited. I always just look forward to this time. This is not that I have a favorite, but I am so in love with the Doula Givers training that the certified end of life doula training is so robust. And so this time is all about you and just want to check in to see how everyone is doing. Week number 3 already. I'm so thrilled. So, not that I have a favorite. Well, everything's my favorite, to be honest with you. But week 3 talks about modules 3 and 4. So, really wanting to spend some time to make sure that everybody is at least close to or in the midst of doing the trainings for 3 and 4. And if you have any questions about those first 4 trainings, that's what this time is for. Um, we're just really here to support you along the journey and just being able to have this live Q&A to help answer questions. Modules 3 and 4 are really incredible because they talk about the transition phase and how to care for someone when they are in that very sacred space. So welcome. Hey, Carrie. Hey, Deborah. Good to see you. Hey, Susan. Nice to see you. Okay, so let's go ahead and so this time will be strictly just to kind of remind, just to refresh in everyone's memories. So the Tuesday is for clinical time together. Thursday is with Suzanne to talk about the path to practice. Certainly here to answer questions about that, but that's Suzanne's um, area of expertise, and she and the team have been working so hard to make this just accelerate your business if that's something that you're looking to do, and then also being mindful about the team that's available on support at doulagivers.com, and then also in the 90-day sprint path to practice Facebook group. And then Friday, of course, is office hours, and I always enjoy that time together too. So let's talk about the transition phase. Does anyone, Cheryl, did you have a question at all? Were you raising your hand? No, earlier? No. Okay. Okay. Okay, perfect. So, yeah, so how are things going? So, do you guys have how was the homework assignment? That's the other thing too. Let's go over the homework. So, for weeks 3 and 4, just really taking a breath with weeks 3 and 4 assignment, especially with module 2, right? We're working on our own interpersonal growth as we are building our business. And so I hope that you have been able to take a moment to do this work around forgiveness. It's a really powerful exercise. So module 2, the assignment 2 was to make a list of all things and people that you need forgiveness to, need to give forgiveness to and for, and then make a list of all the things that you would like to receive forgiveness for. So module 2, assignment 2, was just making a list. Module 3, or assignment 3, was writing a letter to someone that you would like to ask forgiveness from, and then an additional letter to someone that you want to give your forgiveness to. For me, that practice was a bit challenging, and I wrote multiple letters. And I want to really remind you that when we go into this space, that forgiveness component, some are easier to write than others. And I actually still have a letter that I haven't sent yet. I wrote a lot of letters and I burned them. And some letters were never sent because those people have passed on, but it was super healing. I remember doing the letters, and I still have one. There's just, there's tears and you can just see it, the writing is smudged. And I feel like as we continue to be on this journey together, that this forgiveness portion is one of the most powerful exercises that we can do for ourselves. And remembering that the forgiveness is not for necessarily for the other person, it's for our own heart and our healing. So I hope that you took some time, and I know sometimes that that assignment, some people are just not ready to do that, which is okay, but maybe at least starting with a list. That's always the first step, right? Just continue. I have a friend who says, just be willing to become willing, to become willing, to become willing to take those steps. So maybe just consider writing a list and then start with the easy ones first. Um, so that's really an empowering practice, and it will probably continue on your journey. But again, I just want to remind everyone that in order for us to be in this space, because as we continue on this journey into becoming end of life doulas, we really have to do our own interpersonal work so that we can go into that space of neutrality, so that when we do our own healing, we can really create that safe space for our clients and their family members. So assignment 4, here we go. Assignment 4, you are in the stabilization phase with your patient, and you need to ask the primary caregiver to pick a time that the two of you can go over what to expect in the next phase of end-of-life care. So setting aside an hour for each session. This will take a few times, so make sure you have cookies or tea, and then go over all the possible stages of the transition phase. Start with the decline, the inability to eat at the first possible stage, and then just give explanations of each stage. Let the caregiver ask questions, remind them that this is a natural part of the end of life process. Write about the experience in your journal, and even practice with a friend. Now, that is a really powerful practice, going over with maybe your partner or with a friend, a trusted friend, or maybe someone that you are, that you have a relationship with that might be willing to go over that conversation. I feel like it's really important for us to speak those words out loud. It's different. It's so different when it's rumbling around in, at least in my head, unless I speak it out. The other thought that I have, so when we speak it out, it helps to allow us to articulate what we're trying to share with the other person. I have a tendency to say a lot. And so I actually record myself a lot on my phone, and I have a little script of things that I want to say. And that way, for the first round or two, maybe record yourself and then be brave enough to go over it with another person. There is something so empowering when you go through this training and you begin to work with your client and your family caregivers and be able to just share. The words will just come out, but we have to practice. So just want to encourage each of you to do that. So let's open it up. We have Nicholas on the back end, helping us support us. Thank you so much, Nicholas. And so let's answer some questions. How are things going? How are the assignments going? How's the CEOLD training going? Where are you guys at with your modules? You can put it in the chat. Don't be shy. You can raise your digital hand, or you can just we can just do the answers in the chat, whatever feels comfortable for you. So maybe just throwing it out there, how far along are you guys with your module training? Hopefully you've at least completed module 2, started module 3, and if you're an overachiever, you're already on to module 4. So, how are things going for you? Don't be shy. Did you guys enjoy your week? Everyone have a day off yesterday? Mm, yes, I see a couple heads nodding. Lovely, lovely. Yes, Amy, good to see you.
Can you hear me?
Yes.
Hi. Hi,
Hi.
everyone. I had gone through the certified end of life doula training last year, and it's kind of all coming back to me about writing letters of forgiveness. And actually, this week, I just encountered some conflict with my family. And so we're kind of going back on email, but it just makes me think after going through the training and being in this field that I had said, I don't want to fight. Life is too short. I had did like a one-liner apology from something that happened like 20 years ago. And so my whole thing with conflict with people and family is like, life's too short. These people are getting older that I'm, having conflicts with. And so it really just changes your perspective on forgiveness and just how, looking at life, people could not be here tomorrow. So I just want to say for those who are going through the training, it's really important to do that forgiveness piece because, we're helping other people with it. So it's really important for us to do our own work as well.
Yeah. Yeah, so true. Yeah, thank you so much for that. It's
Yeah.
such good insight, and it is it's an ongoing thing. It's an ongoing thing. And even to your point too about, family uh, things that come up with our family members, but also, institutions and, things that are maybe going on in the world and stuff, really just being mindful about when we are offering that piece of forgiveness. What I try to do is, which can be hard sometimes, is, just trying to remember that person might have they might have that this might be the best that they can do right now. And
Mhm.
so, having compassion for ourselves and compassion for them as well. I think everybody is in a different place, but yeah, Amy, I appreciate that. I think things can bubble up and change at a minute's notice, but you are so right. They may not be here tomorrow. So yeah, yeah, good point. Yeah, thank you so much, Amy. I'm so glad that you're here.
Yeah, thanks.
Perfect. Yeah, you're welcome. So let's see. Marcia's here. Kathy, it's good to see you. So, anyone else before I hop in? I wanted to touch bases with you guys just to kind of go over the transition phase because both module 3 and 4 go over that transition phase. And so, what does that look like? Do you guys want to put in the chat maybe what would be signs when someone begins to go into their transition phase? And I love that because you are all going to be the eyes and ears for hospice. You are going to be available, and you guys are going to be able to know intuitively. Suzanne calls it calling it. You're going to be able to call these signs when someone is beginning to transition. So let's just put it in the chat here. What are signs? Yep, Jennifer, good. Sleeping more hours during the day. Yep, eating less or not at all. Perfect, Cheryl. Yep, that's perfect. What other signs could mean that someone might be in their transition phase? Marcia, it's good to see you. I'm glad you're heading home from your hospice volunteering. That a girl. Good for you. Drive careful. Yep, Jake, changes in breathing, whoops, let me see. Changes in body temperature, sudden burst. Yep, that's perfect, Jake. Good job. Yep. That burst of energy. Not everybody gets that. I want to share a story. When I was a hospice nurse, there was a woman who she was just ready to go. I think she was 98. She was in her late 90s, and her family was just so attentive, taking care of her, and she was awake but sleeping a lot. And every morning, she was on daily visits. So as a hospice nurse, we go in every day, and the and the family's like, she's still here, and his mom or the grandmother would wake up. She's like, I'm still here. And so she would have these periods of wakefulness, and then she went into her sleep coma, and I didn't tell them about this burst of energy, but they had an idea that that could come because another nurse had shared that with them, and it happened. And so I came the next day, and they were like, I don't know what happened last night. She had been asleep for 36 hours. She was completely unresponsive. And then she woke up and she wanted Kentucky Fried Chicken, and she wanted to watch, oh gosh, what show was it? It's Wheel of Fortune. It was one of those cute shows. And she got up, she sat in the living room and had her Kentucky Fried Chicken and watched her show. And then she promptly went back to bed. And they were so excited, that they had that last time with her. And so we have to be careful though when someone is in that burst of energy, like Jake talked about, want to be very mindful that when they do have that burst of energy, safety is our number one concern. So they might think, it's time to get up. So, really being mindful about transferring them, making sure that they are able to stand. Usually not. So, needing assistance or at least sitting up in the bed, and then swallowing, wanting to make sure that their swallowing reflex is okay before we introduce food. So, start with something, something soft or some gentle liquids slowly. And if they're able to swallow, then I always just encourage people to just trust their intuition, maybe not steak or something like that because their body can't digest that. But they let her have that Kentucky Fried Chicken and she was thrilled. What a beautiful memory to share with their family. So, yes, decreasing urine output, that's great. That's perfect. Oftentimes when their urine output is decreased, the urine color actually gets darker as well. Not that we're a medical practitioner, but you might notice if someone has a catheter bag, that urine becomes darker, less urine output. That's a great point. So let's see, sleeping more, eating less. Amy White, good call. Yes, seeing people in their vision. So oftentimes people will see angelic figures, they'll see their loved ones that have passed. It is such I think we have to be really mindful that it might be really uncomfortable for their family members, for their mother to see their own family members that have passed over. So just being mindful that, especially if they're still communicative, we we don't know what they're able to see, so we would never want to minimize that or dismiss that, and be curious. I always encourage people to just be really curious in that state. Who is here? And just explore with them these beautiful visitations, because there is something very beautiful and magical and comforting for those folks. So Amy Martin, good, good, good. Agitation. So that's a good point. So that they call it terminal agitation, this restlessness. I got to go home. I got to get ready. Suzanne does a great job when she talks about the the example of packing someone's bag. If they're like, I gotta go. They were wanting to go home, and we don't want to argue with them saying, well, you are home, this is your home. They're looking for their other home. And so really beginning to just meet people where they are at, and just encourage them. If we need to pack a bag for them, letting them settle. But again, with that restlessness or that terminal agitation, safety is always our number one concern, because it can be 24 to 48 hours, maybe longer. To me, that is one of the signs. The visions doesn't happen all the time. Sometimes they're kind of quiet about sharing that, but the restlessness and the agitation, the doulas, you guys will be able to see that sooner. Um, and then, oftentimes there's this uncomfortable feeling of, we just can't get them comfortable. So, repositioning them in bed, medications always our last resort, but sometimes we do have to use those medications. And so we'll be exploring more about medications, but the haloperidol and the lorazepam are great medications for that restlessness. We, of course, don't give the medications, but being aware that those are available. So, yeah, so safety is always our number one concern because that restlessness, they're going to try and get out of bed and do all sorts of things. So, we want to make sure that they are safe. We do not want people to fall because this time when they head into that transition phase is where a lot of falls happen, and then they break a bone or a hip, and then they have their end of life experience that way, which is very painful for the family, painful for the person having that experience. Cheryl, great point. So hot or cold, so temperature changes, that's a great point. So cool, especially as someone is getting closer and closer to the end of life. Breathing changes, someone mentioned, yep, Marla, breathing changes. So you're going to start to notice breathing changes, temperature changes. What happens is the blood begins to shunt from all the extremities. And so hands and feet become cold. As someone gets closer and closer to the end of life, you're going to notice a bluish tinge around their lips, their nail beds. Um, that's at the later stages when they're actively dying. My dad had a fever of 105, and the nurse kept reassuring me that he wasn't uncomfortable. He wasn't really, he was kind of sweaty, but his skin was on fire. And so we just did cool cloths. We had a window open, we had a fan on. The nurse had asked if, do you want a Tylenol suppository? We could do that. I felt like it was kind of invasive, and she just reassured me that he was not uncomfortable. So I did what I could, but trust your intuition. It's kind of like a baby, right? So when you're taking care of a newborn, check their skin temperature. If they're sweaty, take off all the hat. That was what I did. I didn't get lessons as being a mom. I didn't know. I just always had my baby bundled up. And this one older woman said, "Oh my gosh, he's just sweaty. Uncover that child." And so off with the hat, off with the booties. I didn't know. And so just being really mindful about just checking their skin temperature. If they feel hot, just take those socks off, take off the blankets. It's okay to just have a nice sheet over the top of them. If their skin feels cool, I love throwing a blanket in the dryer for 10 or 15 minutes and letting them snuggle up with that nice warm blanket. So those are all great tips. And Jennifer says they may be able to verbalize that they're dying. Excellent point. Yeah, people may be they know they have that understanding and that intuition that something is changing. So all of those. Great job, you guys. Great. Hey, Marla. Good to see you. Oh, let me unmute you here.
I think
There
I
we
can.
go. Yep. Hello.
Hi.
Hi.
It's really nice to be able to come back in and have review like this. Um, I really thank you for making that opportunity for the people that have just recently become um, doula givers. And so I just thought I would share something. I was preparing my event and called on a community hospice to see if they would be part of it. So that's later on. But they asked me to come in and they wanted to interview me to be a volunteer. And so what happens there is people only come there when they're not ambulatory, so they can't walk, and they have 2 weeks to a month to live, maybe longer, but that's where they are. So they're already in that transition state. And I just want to say that so I've been there now 3 times, and the the patients are absolutely having all these symptoms like what we're talking about, and I'm observing them. And the first one, I walked in the room, the man just started, his breathing started really changing. So he was moving, into an active state. But um, what's really interesting is some of the people that come there. So, and I'm observing this one woman. So they came and they expected this woman to have a day, maybe two. But in this place, it's just a beautiful, loving, warm setting. And they aren't really eating anymore at that point, but they said, "Are you hungry?" And she said, "Yes." Well, I've been there like 3 weeks now. And she started eating. Well, she started getting better. And today she's being moved. So she's now not in transition. So if that happens, then she's going to go to another place that's closer to her family. But I just thought it was really beautiful to see. She from the love and the food of how she was being cared for, and they weren't giving her a lot of medication. And I don't know, it was just really just so heartwarming to see that happen. And yeah, I just thought that I would share that because it's really interesting now actually being live in real time with the patients, and it's just a really beautiful experience. Yeah.
Oh, I'm so glad that you're having that experience. What a great, what a great thing to witness and have some knowledge. And then also, you know, I love that reminder of like I don't know exactly when someone's going to have their end of life experience. I'm curious to know what her diagnosis was, Marla. Do you know?
um it was something terminal, but I think Alzheimer's, and then she had something also terminal. So she is terminal. uh it was shared with me that she has Alzheimer's.
Okay.
And but honestly, I went in, she told me what she wanted to watch on TV, and she wanted romance movies. And I said, "Romance with comedy?" She goes, "Oh, yes, that kind."
Aw.
And I fed her. She can't feed herself. But I think Alzheimer's was like high on the list with something terminal.
Okay. Okay. Beautiful. Oh my gosh. It is so fun. You know, one of the things with Alzheimer's, with just a dementia diagnosis, um, that's different than folks that have cancer or um, end-stage renal failure or any cardiac issues. Their trajectory for decline is um, pretty obvious. Oftentimes with a cancer diagnosis, there is when they get admitted to hospice, typically what happens is that they'll be admitted. Typically, they're admitted because they're having an increased amount of pain. The cancer has metastasized, and depending on the cancer, of course. But then what typically happens is once hospice gets them stabilized and their pain is well managed, they are in this beautiful stabilization phase, and that can go for quite a while until, now, don't quote me on this, but this is just my observation. What typically happens with cancer diagnosis is that they'll have a pain spike, a pain crisis, and then they'll have a steep decline and have their end of life experience. That's typically what happens. And renal disease, we're going to talk more about this in the future modules, but like renal disease and cardiac, usually it's, a pretty steep downhill. Alzheimer's and dementia and, Lewy bodies and all the different types of dementia, it's this rolling hill, right? And so oftentimes I saw it more often than not. Oh my gosh, someone is admitted to hospice, they haven't eaten for several days, they're sleeping, and then they wake up just like Marla described, and then they're eating and talking, and so it's just this rolling hill of what happens. So we just have to be really mindful. These just beautiful family members, these family caregivers, especially with dementia, this can go years. And
Mhm.
so it's just this decline, they're up and they're down, and so it's painful, I think, for those family caregivers, especially because they have been on a long road and they're tired. And so when someone finally gets admitted to hospice, they're thinking, oh my gosh, they're preparing for the end. And then what can happen, like what probably will happen in Marla's patient's case, is they might be getting so well that they'll graduate from hospice or they'll be discharged. And this is very challenging for family members, especially if someone is at home or even at a facility, because they lose all this extra support that hospice provides. Oftentimes there's volunteers that's going in, there's social work, there's chaplaincy, there's nurse, there's an extra set of eyes and ears, and it can be really disconcerting for the family members. It's like, what am I going to do now? And so they're again in that cycle of not having as much support. And but typically what happens when someone is admitted to hospice, they have a 90-day certification period. And then I think it's 2 or 3 times they get 60 days. So they'll recertify in 60 days, recertify in 60 days. And I don't know, I can't remember if it's a third 60. For sure it's a 90, 60, 60, and then it goes from there. And so they will continue to evaluate if a person continues to decline. And oftentimes the hospice nurses will be charting to the decline. That's what they call it. And so doing measurements, especially with those dementia clients, doing measurements around, they call it a MAC, which is a measurement around their arm that tells if they're losing weight, and other identifiers that will be able to determine if the person can stay on hospice or not. But it can be really painful. And so that's another wonderful thing as an end of life doula, is we can kind of help support the family, educating them about this roller coaster
Mhm.
for our dementia
Mhm.
clients. But I think my one of my favorite doulas is Gabby Jimenez, and and I think any hospice nurse or doula, you guys will get asked this question, when do you know how much time they have? And my favorite nurse, Gabby, says, we only have today. So, I do think about that a lot, about trying not to assume when someone is going to have their end of life experience. And so, like we learned in the transition phase, there are signs when we know someone is getting close.
Mhm.
They're unresponsive, they're incontinent, they're no longer eating and drinking. You will notice the temperature changes in their body. There will be color changes. There will be that breathing pattern. The breathing pattern is I just want to encourage each of you to trust your intuition. You are going to know when someone has entered that phase. You're just gonna have an awareness. And one of the signs is the breathing changes. And what I tell a lot of my clients, their family members, is um, I try to match my breathing with their breathing. Sometimes I'll just gently lay my hand on their chest and just observe the breath. So, what will happen typically is someone will have um, all sorts of breathing changes, but typically what happens is um, dying to me is very similar to the birthing process. And so we labor coming in this world and we labor going out. And so imagine having a child, observing a woman in labor. There's labored breathing, right? So you may notice that with your client who is having their end of life experience. Their breathing might become very rapid. Eventually, their heart is going to get tired. Their heart rate typically goes up fast, not always. Heart rate goes up, respirations are rapid, and then things begin to slow down, and someone their heart gets tired. And so you'll begin to notice these longer um, periods of absence of breath, and that's called apnea. And so you will notice that the time will be longer. And sometimes people stop breathing for a long time, and you think, oh my gosh, this is it. But you'll notice those are usually within hours. You know, someone should pass hours to 24 hours, usually someone, but not always. I have been fooled a lot, you know. So again, this is just such a sacred space. So let's talk about what can someone do. They are no longer talking, they are no longer responsive, they are no longer eating. The family may not know what to do, but you know what to do. So what would be supportive for the family members and for the patient? Repositioning. Cheryl, excellent. Repositioning, that's such a good point. So, repositioning is so critical, especially when someone is not able to move themselves. When I was a hospice nurse, there was a beautiful family. I will never forget this family. And they just kept him on his side. It was on his favorite side that he slept on. He had oxygen and he developed just a really bad sore on his ear because they just wanted to keep him comfortable on his left side, and so he developed a really big sore on the tip of his ear. And so just really being mindful about all of those bony prominences, cushioning, repositioning is really important in the hospital when someone is in the hospital to get well. The typical time is to turn someone every 2 hours. Please don't do that when someone is at the end of life. It's very disruptive. They're in their deep sleep coma, and being moved around often can be really uncomfortable for them. So don't, reposition them frequently, but, I would say 4 to 6 hours. Don't, if someone is sleeping, if they're comfortable and they're in bed, sleeping comfortably at night, and the caregiver is exhausted, you know, it's okay if they aren't moved for 8 hours, but typically, trying to reposition them, not having them sit in the same position can cause bed sores and skin breakdown. So just being really mindful about that. So great, great, Cheryl. Thank you for that. Amy White, mouth swabs, perfect, perfect. So there's different types of mouth swabs. One of the things I learned as a hospice nurse that I'm just going to share with you, and you all might know this, but I'm just going to share it with you just in case. So those mouth swabs, they're pink or blue or they're different colors. They're spongy, right? And so what I've seen when I've gone to homes and facilities is that they'll use a mouth swab for their loved one, and then they'll just leave the mouth swab in the water soaking. Please don't do that. Especially what happens is when the person is no longer, when they've lost their ability to swallow, that foam swab can actually hold a lot of water, and it really can cause, they're not going to be able to swallow that water. And so what I usually do is just dip it in water just to moisten it, and then I kind of just wring it out along the side of the cup so that try to remove as much of the moisture. Because what happens, another thing that when someone is in their active dying phase, is that I don't really like the name, but this is what they call it, the death rattle, terminal secretions. I love Suzanne when she says closer to source secretions. I love that so much. So that's what I choose to call them. But it does happen, and one of the contributing factors is that that mouth swab can just be saturated, and they just aren't able to handle that fluid load from the oral swabs. And plus, they're getting oral medications that are supposed to slowly trickle down their throat. So if we're introducing more fluid, that can really increase the amount of secretions. So when someone does have those terminal secretions, repositioning is a perfect thing, Cheryl, to do. So a lot of hospice nurses like to use medications to help with the secretions in their mouth. Not a big fan of it, but I wasn't a big fan of it until recently on my last doula client. The staff at this facility did amazing, and they used these atropine drops, and she like no she was they did it really did well with handling those secretions. So I kind of take that back, but as a rule, They typically don't work. Sometimes they use a little patch, a scopolamine patch, or they use drops to help dry the secretions. But what ends up happening is their poor mouth gets really, really, really dry. It doesn't help too much with the secretions that are trapped in their throat. So so yeah, repositioning is beautiful. The mouth swabs, they also have lemon glycerin swabs that you can keep in the refrigerator to keep them nice and cool. But I usually just rinse out their mouth with a moistened toothette, and then there's an oral gel that hospice usually typically supplies. So there's also something in your doula kit, some oral gel that you might want to keep on hand, but hospice typically supplies that for you. So moisten first, clean, even their tongue, if you can get to that. You want to be very careful that they don't bite down on that. So just kind of around their teeth. And if you can kind of swipe over their tongue, that's great. But sometimes those secretions can build up, and that could be a really good tool to kind of help remove that. Repositioning them, putting a little towel right here to kind of help if the secretions become a lot, but repositioning will be your friend at that moment. Yes, Kathy, excellent. Keep talking to them. I'm telling them what the weather is like, who has visited. They can hear you. You are absolutely right. Yes, yes, yes. You know, one of the things that I do after someone, even when someone passes away, I still talk to them. I feel like their essence is still there. I feel like letting the family know, that I think one of the things that kind of bothers me just a wee bit when the funeral home gets called eventually, they're like putting on gloves, and it's like we were just touching them with our hands, within reason, not always with gloves. And so it just becomes this sterile environment. And so just being mindful about their presence and just being there for them. Yes, continue to talk to them always, and never, never, never say anything that you would not say in front of them if they are awake. That is such a powerful tip. One of those doula giver pearls that Suzanne has shared in her training. Like, imagine them sitting there. And so being mindful about your words, and they can still hear you. Jake talks about pleasant sounds. So what does that sound like? Music, maybe. Opening the windows so that they can hear if someone lives by a creek or children playing outside. Um, the noise in the house. There was a gentleman that I took care of as a hospice nurse. I think people die the way that they live. Yes, Jennifer says soft lighting. Perfect. Dim the lights. I'm putting pictures out. I try to encourage people to invoke all the senses. So imagine, and you guys are going to be able to help people in this stage. Imagine putting yourself in their bed and just looking out and imagining what they are seeing, hearing, smelling, feeling. Rough blanket, or is it a soft blanket? Is it gentle touch? Music, that soft lighting is so important. Oh, so that gentleman I was telling you about, I was a hospice nurse, and I come walking in. He was on daily visits, and he was in the living room, and I'm imagining, oh, setting the scene, soft music, soft lighting, flowers. Oh no, they were having a party. They were all drinking and having a ball. And I was like, oh my gosh. But they told me from this is what he wanted. He wanted to go out with a party. So we're having a party. And I was like, you go, buddy. And they were playing rock music, but that's how he lived. And that's what he wanted. And so I did remind the family members, if he begins to flinch a little bit, if it gets to be too noisy, just kind of pay attention to their body, because if they're scrunching their eyebrows, or these nonverbal cues will be important to pay attention to. So yeah, Christine wrote for my dad when we used mouth swabs. We had one person clean off the swab in the bathroom and then hand to the person using them on dad. One thing I never figured out was the secretions or the gunk. Oops, it was purple. First thought it was a sponge, but it didn't seem to be. Kathy, great point. So secretions can have many colors during the transition phase. Respiratory therapists and have seen many different color secretions. Yeah, beautiful. Yeah, I know. I think that we have to be mindful. Things, the body's going to be making some noises that maybe uncomfortable for family members. There might be some odors, sometimes with a dry mouth, or if they're incontinent, if their urine is really concentrated. One of the things that we'll learn about in the future is someone who has maybe colon cancer or rectal cancer. They might have some stools that that might have a strong odor. So just being mindful about, no big deal. We're just gonna help clean that up and just try to make it as comfortable for everyone, and just no big deal. And expressing the that this is all normal, right? And so, to Kathy's point, this is all normal. There's going to be color changes, there's going to be noises, there's going to be all sorts of things going on, and just reassuring the family members that this is all part of the dying process. So we'll get more into the disease processes and what to expect. That will be more to come, but just kind of having a mind in your mind about just reassuring the family members. So Amy says a couple hours before my husband passed away, he was groaning because I had the volume try it too loud for his baby. Yeah, so we learn. Yeah, 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 yeah. It's really paying attention to those cues of really what feels comfortable for them, and just being mindful. There was a woman who had when I was a hospice nurse, there was a woman who had really bad terminal secretions, or closer to source secretions, and her daughter and her son-in-law were there taking care of her, and they called me and they're like, I can't get a handle on it. And so I went and did a visit with them, and so we just repositioned her mom, and kept repositioning her until that noise slowed down just a little bit, and helping with medications. But they were watching TV, and I was like, "What do you think your mom would want to watch?" And she's like, "Oh my gosh, he loves Elvis." And so we put on Elvis, and oh my gosh, I don't know what happened. It seemed like she kind of just settled in. And I'm going to tell you a funny story. So, talk about synchronicities and things like that. I really want to encourage you all to use your intuition and be mindful about the synchronicities and the magic that can happen when we are involved in this work. So I took care of this woman. They're talking about Elvis. She had everything Elvis, I guess, in her bedroom. She had dementia. Her daughter was her primary caregiver. They were tired, had been doing this for a very long time. She had one of those cardboard cutout, life size of Elvis in her bedroom. And I was like, I haven't seen one of those. And so she was like, "Oh yeah, she just loved Elvis." So I went on my way, and help get that beautiful woman comfortable. The next day, she had had her end of life experience. The following day, I went into a facility to help with someone, and I went into the conference room to talk to her nurse. And I kid you not, there was an Elvis cutout, life-size cutout Elvis in this conference room, and I thought, I'm just going to take that as a sign of, these beautiful synchronicities that happen. Oftentimes to me that just feels like, oh, you're on the right path. And so I really want to encourage each of you to just slow down and take a breath, and allow yourself to be present. Because if I hadn't gone in that room, I might have missed that whole thing. And so, um, I think that there is some beauty in the power of the pause. And that's what we really get to do in this transition phase the whole time. So, what's some other things that you guys can think about for the family caregivers to be present when someone is getting near the end of life? Christine says, "Your mom had one." I love it. See, it's more common than I realize. I love it. I love it. I love it. Yeah. Yeah. Soft voices, Marla. Yeah. One of the things I think about is massage. doing these complementary therapies. So, what about, oh, Jake, beautiful, bringing a pet, absolutely. Those fur babies, bring those fur babies in. Children, right? Allowing the kids to come in. I think it really helps kids to explain, age appropriate, the process that's going on. I think it really helps. One of my favorite things that my one of my favorite things is the Good Death Seminar series. I just love it. And in the Good Death Seminar series, at one of the last trainings, Suzanne talks about, and it's in her book, the Good Death book, talks about inviting children into the space. Children are intuitive, and they understand what's going on. And so if we can really encourage children to be a part of this, again, age appropriate, let them read to their grandma or mom or dad, or, letting them rub lotion on them, maybe letting them tell a story or something like that. There's something really sweet and tender about inviting our kids and our pets into that space. And I think what can happen is it really helps the grieving process, because as they're beginning to notice a decline, there is, I think, a better understanding of, a little easier for those littles when their loved one has passed, because they participated in that dying phase. We death used to just be everyone died at home, right? And so the whole family was involved. And so we've somewhat removed family members in this space, children, um, and just I don't we've just I think we can do better in helping to reduce that fear. And I do truly feel like it helps with the grieving process. Marla, my father, loved when I massaged his hands. Beautiful. Yeah. There's something powerful about touch. We just don't touch each other enough, and I feel like there's just something so healing about presence, right? Our presence is the greatest medicine. And I think oftentimes we're just used to just grabbing medications. Oh, they seem a little restless. What if they just need to be repositioned? What if they, like, to the point about, let's see, um, Amy, about what the noise might be too loud, or, just noticing, oh gosh, the light might be too bright, or oh gosh, they might be too warm. So let's uncover them first. Let's do all of these comfort things first before giving medication. Of course, give the medication if needed, but I do think that paying attention to those verbal cues will be your superpower among many things. So Jennifer says, reminding caregivers to take care of themselves. Yes. Oh, such a good point, Jennifer. Yes. Excellent. Yes. Taking a break, eating, drinking, getting fresh air, going out for a walk. Such a good point. So that's the beautiful thing about what doulas can do, is offer that time. What if they're not dying, right? What if it's like, oh my gosh, we've been sitting at the bedside for hours, for for days. Maybe they're waiting for everyone to leave, right? Maybe they need to do this on their own. And it happens more often than not. Everyone's there, and then finally they go and grab a bite to eat, or go get a cup of coffee, or go take a shower, and then someone has their end of life experience. And what we can do is help provide that information to the family, that they really needed to do this on their own. And I think listening to so many people that have done this training, and then also the people in the larger scale who are taking the 90-minute free training with Suzanne, so much healing. My gosh, I've been carrying this around for 40 years, right? I wanted desperately to be at the bedside of my parent, and then I left, and I've been carrying this around. And so really it helps offer some comfort knowing that sometimes people have to do that privately and on their own. They wait for everybody to go. And I do feel like, especially if the family is kind of huddled around the bed and talking and talking, talking, it is a lot like labor, right? So it's like the woman is like, massage my legs. Don't touch me. It's a lot. It's a lot, because they are focusing on this final journey, and it is a solo journey. And sometimes they have to focus and concentrate, or they are focusing and focusing and concentrating. And sometimes it's just things kind of become very simple. So we have to kind of simplify it. So don't take it personal if someone does have their end of life experience after you leave. Um, yeah. And, self care is so important, especially when someone has their end of life experience, right? What do we do? Oftentimes people will just hurry up and pick up the phone, right? And they'll be like, oh my gosh, we need to call hospice. No, you don't. I always encourage my family members to take all the time that you need, have a cup of tea. The phone calls can wait. Just being in that space really allows time for us to get used to that our person is no longer with us. As they take their last breath, that will never return. It really helps to um, pause. We're not human doings, right? We're human beings. And sometimes that is the most uncomfortable space because we're used to doing something. But once your loved one or their loved one leaves and goes to the funeral home, they're not going to get that time back again. So I always encourage people, take this time, as much time as you need. Always encourage them to bathe them, get them ready, dress them in something beautiful. I have a beautiful um, when I was a hospice nurse and then a doula later for this client, the family members, I was so excited for them. Their mom, who was beautiful, had this beautiful end of life experience. They dressed her, they put flowers all around her. She was gorgeous. They didn't call the hospice team for several hours, but they sent me a picture and they had the most beautiful ceremony. Family came over and they really took that time to spend all the time that they needed with her. And we can do that. We can encourage that. Planning, encouraging them, but bathing, this is the last time that you're going to have time with your family member and you're not going to get this back. So yeah, Marla, go ahead. Do you have your hand raised? Nope, that's just your light. Sorry. Oh. Okay, so Marcia, I'm wondering for much time we spend weekly with the patient and family. I'm wondering for how much time weekly with for each phases. Sometimes it can go quickly, sometimes it just depends. That's why I always encourage people to try to, hire doulas as early as possible so that we can help support them. Oftentimes what happens though is people get admitted to hospice so late, and so really as end of life doulas we can come on board as early as possible. So um, it can be whatever your practice and whatever the family caregivers feel like they need. So for one of my clients, I started out 3 hours a week. I was with her for about 4 months, and then as she continued to decline and change, she had changes in conditions, then my time with her increased. And so it's really dependent on what the family caregivers are requesting, if you're able to. So that can be predetermined. I've done a couple of overnights with family members just to give the family caregivers a break. So you can support people in whatever feels right for you. Um, Christine says, as my dad was nearing the end, my sister and I were on either side of his bed close to him. We talked to him, telling him it was okay, that mom was waiting for him. I just started painting a picture for him on what I hoped he would see. Christine, that's beautiful. Beautiful sunset. Mom sitting on a bench looking over the water. He could sit with mom and have a cigar and favorite drink. I told him his dad was there ready to take him fishing. Just kept repeating that over and over and over again. I really hope he saw that since. Oh my gosh, Christine, that's beautiful. That's exactly what I would want to hear. That's exactly what I would want to hear. I think just the sound of our voice, there's this frequency, there's this energy that our voice, this carries, this tone that can be so comforting. It's beautiful, Christine. When I began as a hospice nurse, hospice volunteer years ago, my first patient was 15 years old and came to their house so that her parents, who had not left her side, left to purchase funeral clothes. Oh, it was when they, yep, exactly. Yeah, yeah. Sometimes people just really need to have a private departure. Amy, question. I always think to call the funeral home, but don't we want that hospice knows the patient has passed away so they can come and declare them deceased? So good point. That's a good question, Amy. So yes. So what you could do is you always want to just pause and ask the family members. um, you have an option to stay with your family member as long as you feel comfortable. Um, the state, I think most states say you can keep your loved one up to 24 hours, but you want to be sure and check the state regulations on that. But yes, so you want to communicate with the family members. So, and I typically let family members know after someone passes, typically when the funeral home is called, and you can call the funeral home or the hospice nurse can call the funeral home, um, 30 minutes to an hour, depending on where you live. Sometimes it can take longer depending on where you're at. So I always talk to the family members and let them know once the funeral home is called, then that gets activated, and then we can't control how much time it takes for the sometimes it's 15 minutes. And so I always ask the family members, would you like me to call hospice? Um, and so what you can do is talk to the family members and say, we can call hospice and let them know that your loved one has passed, but we're not ready for them to come. So typically, I've seen it go both ways. So hospice can come, pronounce, and then leave. But hospice nurses are so busy that that requires two visits. And so depending on where they're located, here in the valley, they could be 45 minutes away and they might get another call. And typically someone dies in the middle of the night. So they may not have the bandwidth or the support to make two visits. Or the hospice nurse, and it happens all the time, the hospice nurse will just say, just let us know when you're ready. And oftentimes you can ask too as a doula, would you like the social work? Would you like a chaplain? Would you like some additional spiritual support? And just really being mindful, reading the room, because you might have several family members that are all having completely different experiences, right? So there might be one that's really not doing well. You might have one that's doing very well, and children. And so really be a good servant to read the room, because you may not be able to support everyone. But if we've done our job really well, then by the time someone has their end of life experience, we can invite the family members to say, have stories. Another thing, while someone is actively dying and afterwards, reading passages from their favorite spiritual texts or anything like that. I think that it can be a beautiful time, but also reading the room. So it really depends, asking the family members what they would like to do. Yeah, so hopefully that answers your question. Oh, thank you, Nicholas. We are entering the last few minutes of the call, so if you guys have any last minute questions, be sure um, and do send an email to support at Doula Givers. Christine, I love all that you posted. Oh, Deborah says our hospice nurse lovingly washed my mother before the funeral home came. Beautiful, beautiful. No problem, I can't remember if it's Marcia or Marcia. I will try to be better about that. Can I ask you guys a favor? Can we do hearts? We've got hearts back up, and I would love to take a picture if you guys can indulge me. And then we can post it in the group, because I just love that you guys get to spend time together. Yes, so it's the heart without effect. So just the heart. So we'll wait for everyone to go down, and then we'll do it one more time here, and then I will take a picture. Thank you, Susan, for coming on camera. I appreciate it. If everyone can come on camera, if you can't, that's okay too. Okay, on the count of three, I want everyone to put their heart up, and I'll take a picture, and don't forget to smile. Thank you. All right. Perfect. All right. Excellent. Way to go! Amazing doula givers. What a great evening. Congratulations. You're already well into week 3. I'm so proud of you. We will see you in the group, and we'll see you Thursday with Suzanne. Okay. You guys take care. Bye.